Hi, my name is Yuntrell. Today I'm going to be demonstrating IV administration via minibag. The first thing I would need to do is implement my standard protocols. I would be checking my MD orders, making sure that the correct medication, the dose, the frequency, the route is all correct for my patient. The next thing I would need to do was educate myself on the medication. The medication that I'm going to be giving is Rocephin IV. The action, it binds to the bacterial cell wall membrane, causing cell death. It's bactericidal. The purpose is for the treatment of infections and perioperative prophylaxis. Recommended dose is 1 to 2 grams every 12 to 24 hours IV. Side effects include seizures, diarrhea, cholelithiasis, rash, bleeding, allergic reaction, superinfection, and blood dyscrasia. This medication is contraindicated for hypersensitivity to penicillins and cephalosporins. It should be used cautiously when pregnant or if history of GI disease. Nursing implications include obtaining culture and sensitivity before giving the IV therapy, obtain history of allergies, observe for signs and symptoms of anaphylaxis, and monitor bowel function. The medication will be infusing over 30 minutes. For my scenario with my patient, the doctor has ordered Rocephin 1 gram every 12 hours IV, diluted in 100 ml of normal saline, 0.9%. The drip factor is 10 drips per minute, as indicated by my IV tubing. For my drug calculations, I was to calculate how many drips per hour. 33 drips per minute is what I've calculated. I came to that conclusion by calculating 100 ml, which is the amount of my bag, my drip factor, which is 10 drips per minute, multiplying that by my time, which is 30 minutes, and that gave me 33 drips per minute. I also want to make sure before I go in my patient's room that I verify the labs and the allergies of the patient. Okay, so before I go in my patient's room, I need to collect my supplies, and my supplies will include my IV tubing, my bag, my syringe, my normal saline syringe, which is pre-filled, my syringe for drawing up my drug, my needle for drawing my drug, and some alcohol preps, and some tape. So the first thing I'll need to do is wash my hands and put on some gloves before I prepare my medications. Then I will proceed. For this medication, I have to use 1 gram equals 2 mLs. My prescribed dose that I'm going to be giving is 1 gram, so I'll be taking 2 mLs out of this bottle. I've checked and seen that it's not expired. My medication in my bag is not expired, and my bag here is in intact and good condition. Wipe the bottle, let it dry, connect the needle, uncap the needle, withdraw 2 mLs of air, insert into bottle, insert air, withdraw medication 2 mLs, clean mini bag, insert needle cautiously into mini bag, making sure not to perforate bag. Discard needle into sharps. Gently shake bag to evenly distribute medication in bag. Label bag with the patient's medication, the dose, the time, the name, my name, and date. Then I will need to open my bag, I'll go ahead and label my tubing with my time, my initials, the time and date. I will again make sure I have my name, then my initials, and then I would have the date and the time that I set up this tubing. Okay, now with my materials, I'm ready to go inside my patient's room and begin my procedure. Hi, Mrs. Smith. It's Yuntrell. I'm coming in to give you some IV antibiotics today that the doctor's ordered. Can you first just let me know your name and date of birth? Okay, Mrs. Smith, I'm verifying that with your name band and against my MAR. I'm going to make sure, do you have any allergies? Okay, I'm going to be giving you Rocephin. Do you have any allergy to that? No. Okay, well, good. So the next thing I'll need to do is look at my patient's site. But first, I'll go ahead and wash my hands again and put on my gloves. So now that I've washed my hands and put on my gloves, again, I'll come back to the patient, look at the site, make sure that the INT looks patent, and it does. I'm got my gloves on. I'm palpating for any tenderness. I don't see any tenderness. Making sure that the line is still clamped. Then I'll go ahead and let you know, Mrs. Smith, I'm